1 billion. It's an enormous number. That's how many people live with a disability across the world right now. That's 1 in 7 people on the planet.
The federal government is considering a major overhaul of disability support payments.
The social security payment we have chosen to focus on today is the disability support pension. We will be discussing this social security benefit, the experience and impact of poverty on the people who receive this payment, the individual and structural explanation of how this group is affected by inequality and poverty, and we will be arguing how this payment does not alleviate poverty amongst this population group. In 2009, 18.5% of the Australian population aged above 16 had a registered disability. I will now pass over to Erin, who will talk about the individual and structural explanation of how this group is affected by inequality and poverty.
There are 2 different contrasting ways that poverty is looked at in today's society. 1, individual poverty, also known as neoliberalism or left-wing, and 2, structural or right-wing poverty. These 2 views contrast very different ideologies and hold very different values of how poverty is explained. Let's start by looking at individual poverty, or left-wing, or neoliberalism as it's also called. Individual poverty was an early idea that came about after the Second World War. It was considered an idea that would sustain the Western world by the beginning of the 1900s. This led to the foundation of the term neoliberalism by Alexander Rustow in the 1930s. One definition of neoliberalism is that stands out is the principle of private property. This reinforces the neoliberal value of the individual against the free market. Structural poverty is the idea that looks at poverty differently to that of the individual neoliberal conception. The structural model more so addresses the issues of multiple socio-economic factors mediating environments around people, and individual circumstances can be greatly influenced by these. When we look at welfare, we can see both sides of these ideas. Neoliberals' attitude to welfare, so social security or Centrelink payments, is quite adverse and quite the opposite of the structuralism point of view. The conception of welfare under the neoliberal ideology can be traced back to Adam Smith, and while he understood that welfare was an important factor in sustaining individuals, he also argues that it must be restricted. David Ricardo refined Smith's ideas, arguing that welfare was counterproductive to the individual. Charles Murray, a liberalist, argued that the idea of equality through the welfare system undermines traditional liberal notions of self-esteem and personal autonomy. We can understand this as Murray argued that the welfare didn't promote individuals taking responsibility for their own poverty, and it creates a cycle of deprivation and permanent underclass. Neoliberals also hold the values that welfare doesn't diminish poverty, but in fact promotes it, promoting the lack of self-resilience, i.e. promoting an independence of income from the government system. This idea was brought around by the article from Turner of 2008. This idea also values the idea of choice, which is described by Burkhart, Evans and Holder in 2015 as another word used for autonomy within someone's own poverty, which they also describe as ethically individualistic. When we look at poverty from a structural point of view, we can see a couple of key differences than that of the individual. Structuralism looks at the values and ways in which the individual's environment and income has affected their position in the socio-economic world. There are many variables which can contribute to one's level of poverty, including income, unemployment rates, housing, specific illnesses, overall health, capacity to sustain work, education, social inclusion, disability, divorce and deprivation, and even more. It also looks at the individual's life course and how they have been influenced from birth to adulthood. Structural poverty holds the ideals that welfare systems empower the poor from the poverty trap. Structural poverty believes that in reducing welfare payments when someone begins working part-time or full-time continues to keep people in the poverty trap, as if it doesn't allow them to make any extra money to be able to move out of this position.
Although this is a large topic, there is limited data available for people with disabilities and how it can affect their health, as there is a wide range of disabilities to narrow it down to one particular answer. The overall consensus is that people with disabilities have worse health in comparison to the general population. People with disabilities must have a health condition / impairment that affects their everyday life so that they can determine a difference in health status.
Income. In Australia, people living with a disability have lower incomes and are more likely to live in poverty than people without a disability. In 2003, the median personal income for people living with a disability was only $225 per week, in comparison to people not living with a disability, which was $480. People may assume people with disabilities have lower education, therefore cannot get a job. This is not always the case. People with disabilities have lower income than people without disabilities, but have the exact same education.
In Australia alone, 45% of people who live with a disability live in poverty or nearing the poverty line. Another reason why people with disabilities are experiencing poverty is because of the lack of job opportunities out there. People with disabilities are half likely to be employed. The Directorate for Employment, Labour and Social Affairs 2009 stated that.
Individuals with a disability will generally have lower levels of education due to their intellectual or physical impairment. According to the Australian Bureau of Statistics, people with a disability are less likely to have completed Year 12 as compared to the 40% of people without disability who have done so. Only 24% of this population has. 41% of this group are less likely to have a higher education certificate, example, diploma or bachelor, compared to the 50% outside of the group. Special schools have had 45% of children with disabilities attending them in Victoria 2011. Studies have shown, though, that the children who attend mainstream schools have more positive social and academic outcomes.
Being suitable, secure and affordable is what appropriate housing can be defined as. Yet again, the disability population group can be disadvantaged and vulnerable in this avenue. The Australian Institute of Health and Welfare states that 95% of disabled people live in households rather than cared accommodation. Many of those people have lost their own homes due to the cost of their lifestyle. There is an inadequate number of supported accommodation, and homeless adults in the past 10 years were more likely to have an impairment.
Due to all these factors, this significantly contributes to why this population group experiences poorer health outcomes. A range of organisations and the Australian community need to work together in order to increase a more positive and sufficient lifestyle for these people.
I'm here to discuss one social security benefit relevant to our population group, which is people living with a disability, and make an argument about the extent to which this benefit reduces or alleviates poverty. The one main welfare benefit that is targeted for people with disability is the Disability Support Pension. The federal government provides the Disability Support Pension. There are other payments such as mobility allowance to help with travel costs for people with disabilities that inhibit their ability to travel. There is also a carer allowance to provide assistance to people that care for people with disabilities. And there are also increasing numbers of people with a disability receiving New Start allowance. However, we are not here to discuss all of these, just discuss the main payment that affects people with a disability. The Disability Support Pension currently pays a maximum rate of around $21,500 per year for singles and around $32,500 per year for couples. Recipients may also be eligible for rent assistance if they rent privately. The maximum base rate is benchmarked to 27.7% of male total average weekly earnings for the single rate of the Disability Support Pension. This is sourced from the National Commission of Audit 2014. Now that I have identified the main payment that is related to providing assistance to people with disability, I would like to discuss how this payment alleviates poverty for people with a disability. People with a disability face a significantly higher than average risk of poverty, with ACOS stating that 27.4% of people living with a disability live in households below the 50% poverty line in 2009-10. An even bigger number of persons with a disability have household incomes in between the 50 and 60% poverty lines, so that the risk of poverty rises to 44.5% for the 60% line. One of the main reasons people with a disability live in poverty is by the very nature of being disabled, they face higher medical costs that they cannot control. These costs are non-discretionary costs associated with their disability, such as specialised aids and equipment for mobility or communication, additional transport and other needs, such as medical treatments and various therapies, as Rose Galvin points out. As stated by the Australian Council of Social Services in their poverty report in 2014, many people with disabilities therefore rely on social security payments, especially disability support pension, as their main and only source of income. With 44 out of every 100 disability support pension recipients at risk of poverty, it would certainly seem that the welfare payments that are targeted to this group are inadequate at relieving poverty and only provide a subsistent life for them.
Raise your voice. Become part of the change. End the cycle.